Looking after a loved one living with heart failure. Hello and welcome to this video guide about looking after a loved one living with heart failure. My name is Sean and I'm a senior physiotherapist working across the UHBW cardiac and cardiology services. This means I'm involved with getting patients mobilising and exercising when admitted to one of our wards at the Bristol Royal Infirmary. In this video, we'll explore things that you can do to support your loved one and how to look after yourself as a family member or carer of someone living with heart failure. The information presented will include data from research, experiences from other patients, and things you can do to help yourself and your loved one. Overview. This video will cover the following topics: understanding heart failure, things you can do to support your loved one, how to look after yourself, and sources of other support. If you have any concerns about your loved one's heart condition, please speak to your GP or cardiac team. There is also further information on the Trust websites, as well as the British Heart Foundation and Pumping Marvellous sites. Understanding heart failure. Heart failure is a condition where a person's heart is unable to pump out enough blood to supply the body. This condition requires a treatment plan which can include lifestyle changes, medical appointments, and medications. People who receive a diagnosis of heart failure may need to make significant changes in their lives. This may include needing more assistance from someone to support with daily living. It is important to remember everyone's experience of heart failure is different. Some people continue with only small changes to their lives, whilst others may need bigger adjustments. Things you can do to support your loved one with heart failure. If you live with or care for a person with heart failure, you may have questions about how you can best provide support to your loved one. It is important to acknowledge that it is normal to feel worried or anxious for them during this time. It is normal to have a range of different feelings about your loved one and their heart failure, including anger and sadness. Providing care for your loved one can involve providing emotional, physical, and practical support. Here are some of the things you can do to support your loved one. Advocate and listen. As a family member or carer, you can ask your loved one if they would like to attend medical appointments with them. This might include raising any concerns they have or taking notes so the information is available later. You may want to also support your loved one to consider any questions they want to ask in healthcare appointments. Managing medication. Your loved one may need to take medication to help manage symptoms and prevent disease progression. You can support by keeping track of their medication and sticking to a regular schedule. You could also learn about what each medication is for or speak to their healthcare team for specific guidance. Monitoring symptoms. You may want to support your loved one with monitoring their symptoms. These might include shortness of breath, fatigue, leg swelling, or dizziness. Symptom changes can happen very slowly, and it may be that you notice any changes before your loved one does. Consider emotional needs. It is normal for anyone with a long-term condition to feel down at times. It is estimated that 1 in 5 people living with heart failure have depression. You can support your loved one by listening if they want to talk and encourage them to do things that boost their mood. If your loved one is feeling anxious or depressed, you may want to consider encouraging them to speak to their GP or cardiac team about further support. How to look after yourself as a family member of a loved one with heart failure. Providing care to another person can take its toll on your own well-being. It is very important to remember to look after yourself when caring for a loved one with heart failure. It is very normal to have a range of different feelings about looking after them, even if you love the person and want to support them. Here are some things you can do to make sure you are looking after yourself. Socialising with friends and family, taking time to do something on your own, staying connected with others, getting a balanced diet, getting enough sleep, taking daily breaks. If you are experiencing too much strain or your loved one needs further support, it is important to ask for help. Consider reaching out to other friends, family members, or the healthcare team or the people in your community, acknowledging that this is hard. Heart failure is a challenge for the person with heart failure and their loved ones around them. Making lifestyle changes for both yourself and your loved one can take a lot of work. It is important you acknowledge the hard work you are both putting in and remember that it is normal to experience a range of feelings in this time. Further support. If you or your loved one have any urgent mental health concerns, you should contact your GP, who can refer to the appropriate mental health support team. You can also call 111 for mental health advice. If someone's life is at risk and you do not feel you can keep yourself or someone else safe, please call 999 immediately. If you are over 16 years old and would like to access support for yours or your loved one's mental health, you can self-refer to your local IAPT service. IAPT also have self-help guides on their websites, which you may find helpful. A selection of further resources and support will also be listed along with this video on our website. Closing message. Providing care and support to someone living with heart failure can take a lot of time and understanding. Remember that there is further support out there from your GP, cardiac team, and other friends and family. You do not need to do it all on your own. Working with the teams around your loved one can make a difference.